Imagine using your nursing knowledge to work in healthcare without being physically in the hospital. Isn't that mind-blowing? Many nurses have been asking me about working remotely as a medical virtual assistant. So let's start from the very beginning. What is a medical virtual assistant? Alright, just like the name implies, medical means you're going to be working with hospitals, doctors, healthcare professionals, clinics, name them. Virtual means you're going to be doing it at the comfort of your home or wherever you call your workspace. You don't need to be on site, you don't need to be present at the hospital. Okay, now assistant means that you're going to be helping these hospitals and clinics with administrative work. All right, let's put it all together. So a medical virtual assistant is someone who provides administrative assistance or healthcare related support to hospitals, clinic, healthcare professionals. Now then, what will you be doing as a medical virtual assistant? Think of what happens in a typical hospital, right? Every day, we nurses, when the receptionist is not there, is not on seat, we nurses, we book appointments. We respond to emails sometimes, we respond to messages, we take patients' call to know how they're doing, we do follow-up. When it's an asked patient is not in the hospital, we do follow-up to know how the patient is actually recovering or faring. We verify insurance verification, we document, that is even our core foundation, documentation. So we document, so all of these things are what you will be doing as a medical virtual assistant. Doesn't mean you do all of these things. Some clients will be like, okay, I want you to be setting appointments. Some clients will be like, okay, I want you to be calling patients and scheduling patients for appointments and all of that. Some will say, I want you to be verifying insurance, or your work is insurance verification. So it depends whatever the company wants or your employer wants. The most fascinating part is that as nurses and healthcare professionals, we already understand medical terminologies. We already understand patient confidentiality. We know how the whole healthcare environment works. So it actually makes the task much easier, right? But let me state this. Just because you're a nurse doesn't make you a medical virtual assistant. You need to get first the digital skills. You need to get the administrative skills. So it's not... You don't just jump into it. And that's exactly what we're going to be covering in this series. I'm going to be showing you what a medical virtual assistant actually do, the skill you need to have as a medical virtual assistant, the tool you need to start learning as a beginner, and how you can also position yourself for healthcare roles. So if you're a nurse or a healthcare professional and you are curious about working remotely as a medical virtual assistant, this series is what you should consider following. Okay, so if you have any question regarding medical virtual assistant or anything, feel free to drop it in the comment section. I'll be attending to all of it.